Hello, and welcome to the Perinatal Loss Flowsheet Education, a guide to the new loss flowsheet and the charting requirements. Upon admission, the clerk will indicate the status of the loss patient on the status board. You can see we have options. There's loss ante, loss labor, loss induction, and loss postpartum. On the grease board, you will then see the status of your patient, noted here. After wrenching in the perinatal loss flow sheet, you can see the new flow sheet that's up here. We will also take a look at what else is new, which is this loss documentation icon, which is now visible on the storyboard of our patient. So looking closer at the perinatal loss flow sheet, you can see that it is divided into 5 sections. We have the acknowledgement of loss, the birth plan, the care consults, post-delivery plans and care, and the paperwork tracker. The first 3 sections, the acknowledgement of loss, birth plan, and care consults, should be completed prior to delivery whenever possible. And then, of course, the post-delivery plans and care would be filled out after the delivery. Our first section, which is the acknowledgement of loss, if we click on the row folder given to patient and reviewed, we will see that we have 2 options. If our loss is greater than 20 weeks, we will provide the patient with a purple folder, and if it's less than 20 weeks, the patient will receive a blue folder. In addition, we will also implement our perinatal loss care plan. By doing that, the information below is what will be covered in the care plan. So continuing with the acknowledgement loss section, when you click on the row, it opens up a cascade and you would choose the appropriate option, fill in the sections as appropriate. So if a name is given, you would type it in. If ask about the desire to see and hold the baby, you can see that there are some multiple options here. Fill it in. And then the consent for photography. Documenting this consent for photography is really important because this can be used as a tracker. If it is not yet signed by somebody and it is charted that way, it indicates that the nurse is aware that it is incomplete and can take steps to finalize it. Once signed by both the patient and the nurse and documented in the flow sheet, it will need to be given to the clerk to be scanned into the patient's chart. All signed and scanned documents will be returned to the nurse to replace into the appropriate envelope. Moving on to the birth plan section. When you click on each line, you could see the cascades, the desire for baby to remain in the room, yes or no, or undecided. If there's a cuddle cot, yes, no, or the patient declines. If there is a desire for a ritual, we gave you a couple of options, baptism, dua, yes or no, and then the type of ritual, if there is one. Our next section, care consults, deals with whether social work or spiritual care was initiated, whether they have been in to see the patient or the patient declines. So continuing into the post-delivery plans of care section, the body identification row would cascade into these options. It's really, really important that you be able to identify the remains and to document in the comment section as needed. With the location of the remains section, this row can be used as a tracker as well. It is a requirement that documentation of the location of remains be charted anytime the location changes. For example, if the remains are moved from the patient's room to the lost room for, say, pictures and then back again, it should be documented each time so it is easy to track the remains at all times. It is also required that the location of the remains be documented at least every shift by the nurse. Continue to fill out the remainder of the section, photographs, whether a memory box was given or not, if the rituals were done or not applicable. And here's an example of a completed chart. You can see every row has some documentation. Now we will work through our paperwork tracker. First, we need to identify our type of loss. By clicking on that row, it will cascade into these options. Our less than 11-week loss, this is the required paperwork. If we had a less than 11-week loss, but with identifiable fetal parts, or the remains need to be returned to the patient, we would initiate the blue envelope and the purple sticker project. Our greater than or equal to 11-week losses, but less than 20 weeks, get the blue envelope. Our greater than or equal to 20-week losses are the green envelope. And our neonatal demise of any gestation get the red envelope. Now we will look at each individual row, looking at the specific forms and requisitions that are required. When you click on the cytogenic requisition form, it cascades into these options. The surgical pathology specimen requisition cascades into these options. Authorization for examination, these options. This is one of those forms that needs to be scanned into the patient's chart, so once it's completed, give it to the clerk for scanning. The final disposition of the stillbirth form also needs to be given to the clerk and scanned into the patient's chart. The beneficiary of coverage row will cascade these options: certification for induced abortion, postmortem patient property form. You can see that once these are all completed, they need to be given to the clerk and scanned into the chart. Very, very important to document when the paperwork is completed and when the remains have been transported to pathology. Once the paperwork is complete, you should mark it. Once you have transported the remains to pathology, make sure you chart that. Only then, once those are charted as complete, then the provider can write a discharge order for the patient. So this may require some prior discussion and planning with the patient that the remains will need to be taken down to pathology before they can be discharged. This is the only way to know that all of the paperwork is complete and with the fetus before it is taken down to pathology prior to discharge. This will allow for no more hunting for the paperwork or having to call the patient at home because something was not signed. It is actually a hard stop. The provider cannot write a discharge order until the paperwork is marked complete and the fetus is transported to pathology and documented. We will now go through the documentation requirements for the red envelope. You can see the placenta specimen requisition needs to be completed. Here you will see the permission for autopsy form, and that replaces the authorization for examination form from the other loss scenarios. We do have a death notice form that needs to be completed by the provider, infectious disease funeral director form, as well as vital statistics needs to come and see the patient before discharge. So what exactly is the Purple Sticker Project? It's how we handle our fetal remains or products of conception at less than 11 weeks, 0 days gestation, but that are wanted for burial or to be just returned to the patient. This is not standard procedure and is considered an exception and should not be offered routinely to our patients. Our products of conception need to be easily identifiable as being different, and so we identify them with this purple sticker. We apply the purple sticker to the specimen container, to the specimen requisition, and to the 2 additional pieces of paperwork that are required for this special exception: the authorization of examination and arrangement of fetal or infant remains less than 20 weeks gestation, and the final disposition of stillbirth form. as much communication and that we can share with each other to ensure that these products, when they are sent to pathology, are identified as needing to be returned to the patient. From the storyboard, when you click on the loss documentation icon, the status of the list of required documents needed to be completed prior to discharge is activated. It's a quick way for anybody to see what documentation has been completed or not. In this case, you can see nothing has been completed. If you click on the link below where it says perinatal loss flowsheet documentation, it'll take you right to the flowsheet to complete the documentation. If you hover over the loss documentation icon, it'll also bring up this list and it'll give you a quick glimpse of the status of all of the documents. The nurse is responsible for documenting when the paperwork is not yet signed or completed, as well as documenting when it is completed and seen by the nurse and known to be done. So looking at the paperwork tracker, you can see that not all of the paperwork has been completed yet. Some of it has been completed, and the post-mortem patient property form is not yet signed. The placenta specimen requisition form is not yet completed. So when we hover over the loss documentation icon in our storyboard, you can see the status of all of our paperwork, and you can see which ones are completed and which ones are not completed. If there is paperwork that is not completed, the provider cannot write a discharge order at this time. So now here is an example of the completed paperwork tracker. You can see all of the rows are completed, paperwork has been completed and charted, the remains have been transported to pathology and charted. And if we hovered over the loss documentation icon, it'll show you that all of the paperwork is complete. At this time, the provider is able to write a discharge order for your patient. So this flow sheet will go live on November the 18th. So start using the flow sheet once you see it. It is important to keep communicating with providers about the paperwork and discharge status throughout the stay of the patient. So the completed forms must be given to the clerk and scanned into the patient's chart and documented in the flow sheet. Leave the scanned documents in the boardroom in the envelope until remains are ready for transport to pathology. Transport the remains with the completed paperwork to pathology and then document upon the return. Provider will be able to write a discharge order for the patient at this time. Thank you very much.